See, if you just try to recall, last class we spoke of Natrum Carb. Hala. And Natrum Carb, I had told you in part. We are yet to complete Natrum Carb. Okay. See, from what I had told you in the last class, you know the key points of last class discussion. What are the key points? Okay, we spoke of sphere of action, ailments from, and we look at the broad headings. I spoke to you about ailments from, sphere of action, pathogenesis, and I also covered a very important part in Natrum Carb, and that was the mental symptoms. Correct? Huh? Okay, so these are few things that we discussed. And if you are all still curious, I started with a case. Okay, and hopefully the curiosity, if at all you are curious, the curiosity will be taken care. Why that particular patient, she was given Natrum Carb. Adanu we will try to discuss. Okay. So now the agenda for today, or before I start with what I have planned for today, do you have any questions in Natrum Carb? Ailments from, pathogenesis, and sphere of action, mentals. Any questions to ask? All clear? See, if it is clear anyway, see, because why I am insisting on this part is, today's class, to understand today's class, the previous topic that we have discussed, that will become very important. Okay. And for today, I will be focusing mainly on the, this was the last slide, only to make you understand so that you start getting connected. We spoke of misanthropy, very important. People who have aversion to mankind, people who have aversion to human being. They want to stay in a place where there are no human beings. Now that is the syphilitic thing you have in Natrum Carb. Okay. Now important for today's session, we'll be discussing particular symptoms. Okay. Please close your books. I promised you in the last class notes will be provided. I'll give you the notes. Okay. Try to understand the concept. See, many of us write and we tend to forget. Okay. And few students have expressed, sir, if we write, we remember better. I appreciate. But when I am looking at you, you know, I'll be like I am looking at the walls, because all of us are busy writing. And for a teacher and for a student, it's always very important we have that eye contact. Allah. Fine? Eye contact is very important. Done? So, I will provide you a notes. I will give it to Shivu, he will just forward it to you. We will focus on this part today, particular symptoms. Now I have been insisting, and many of you students have been trying to tell, the borest part of Materia Medica is understanding particular symptoms. But particular symptoms are also very, very important. Fine? What Dr. Honeyman says, mind and body. Entirely prescribing a remedy only on the mental symptoms can be very dangerous. Okay? Or just prescribing a symptom on the particular symptoms can be equally dangerous. So we have something holistic, and this is what we say, mind and body. Okay? So particular symptoms are equally important. Done? And probably the case that I will be sharing today will also emphasize the importance of particular symptoms. We will discuss that part. Okay. Now important for you is, how do you study particular symptoms? Now what you feel is boring, how do we make it interesting? Fine? That is the challenge, or that is the question. Now understanding particular symptom, we have a small formula or we have a small method. If you understand particular symptoms through this methodology, then it will never become boring. Now any inputs from your side? How do you make particular symptoms interesting? Okay. Okay, you look at the location, you look at the sensation, you look at the modality, and you look at the concomitant. Fine. So this is one pattern. Good. Now, before that, how do you understand particular symptoms? What are all the important components in understanding particular symptoms? Okay, good. You understand the sphere of action, you understand the pathogenesis, you understand the ailments from, then you understand the modalities, and 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 you understand the PQRS or the generalities. See, if you know all these things, then particular symptoms will be very, very interesting. Okay, for example, with Natrum Carb, we'll try to explore this method. And similarly, you can use this with other remedies also. Okay, so to start with, sphere of action becomes important, ailments from becomes important, and the PQRS, and of course the modalities. Now, you will have to quickly recap where Natrum Carb is acting and what are all the ailments of Natrum Carb. Once you are clear, then these things will become very easy. So, sphere of action, where do you see Natrum Carb acting? Very good. GIT, connective tissue, skin, female genitalia, very good, good. And what are all the probable ailments we discussed? Yeah. Yeah, very good. Then. One second. It reminds me of me being in Tirupati. You know, everybody will be shouting, Govinda, Govinda. Right? Very good. Anyway, so I'm happy with the interaction. But what is important? I've been insisting. Whenever natrums come, what is very important is sun. Sun aggravation, very important. So this is what you need to remember. Sun aggravation. Done? So aggravation sun, that is a point you will have to remember. So one was aggravation sun, second in Natrum Carb, milk, good, agreed, milk. Yeah, slightest change in error in diet, good. Then overstrain, mental exertion, overstudying, grief. Okay, good. Mental exertion, yeah, all those things. Thunderstorm, yes, yeah, your friend was telling. Thunderstorm. Music, fine. In Sabina, it will cause sadness. In Sabina, you don't have suicidal disposition, or you don't feel like committing suicide listening to music. Sabina causes more of sadness. Okay, so we'll get back. Now the important thing here is, if I am talking of head, particulars will go from head to toe, and whichever area is important, I will be focusing on that particular area. Correct? Huh? So when you look at head, now your friend said, sir, location, sensation, modality, concomitant. Good, we will follow this. I will be going one step ahead. Now what is that one step ahead? We will be looking at ailments from. Just now you gave me so many ailments, agreed? Now your duty is, those ailments, okay, you need to pick up the ailments which can cause head complaints in Natrum Carb. Now one second, let me finish. I know the Josh of your class, good, I appreciate. Now what is very important is, the ailments that I gave you under the heading ailments from was general ailments. Are you getting this clarity? Now we are looking at particular ailments. Out of those general ailments, which are the ailments which are capable to produce head complaints in Natrum Carb? So those things will be picking it aside. Okay, now you can start. Before you start, one is ailment. One second thing, you also need to understand what symptoms can come up under head in Natrum Carb. Okay, more than vertigo. First very important thing is headache. Okay. Now what could be the probable causes for headache in Natrum Carb? Sun. You know. One second. So now in Bangalore also it is very hot. For example, you go under sun, fine, and you land up with a headache. It could be one of the important cause of Natrum Carb. Many girls they will not like, or many boys they will not like sun. You might be seeing them with an umbrella, or you might be seeing them with a dupatta, fine. Only eyes are visible. They would have wrapped themselves because they can't take sun, fine, or you may be seeing them with cap. Okay. So what you need to understand is sun causes headaches in Natrum Carb, and in Natrum Carb sun has lot of value. I told you the natrum in which sun aggravates. The first remedy that should come to your mind is Natrum Carb. So one very good sun, apart from sun, overstrain, over exertion, mental exertion, good, possible. One, okay. What did we discuss when I told you about thunderstorm? Thunderstorm mainly causes anxiety. No problem. Thunderstorm mainly causes anxiety and restlessness. So in Natrum Carb, you don't have thunderstorm causing headache. Okay. So thunderstorm will not come under head symptoms of Natrum Carb as an ailment. Okay. Must be in some other remedy, thunderstorm might cause headache, not in Natrum Carb. Done? And one more very important thing is sunstroke. Okay. Sunstroke, chronic sunstroke. Natrum Carb is a very important remedy. Any other wild guess? I have not mentioned it under ailments. If you just see here, you have sunstroke, you also have overstudy, mental exertion, and one thing we missed here is working under gaslight. Now, any quick inputs? Why gaslight? Heat, beautiful, very good. I like that speed. Heat in Natrum, heat of sun, heat of gaslight, fine, can cause problems in Natrum Carb. And what is that problem you have in Natrum Carb is they will have headaches. Okay. So headache, yeah, people working under gaslights, headache. Now when the question of headache comes, your friend said, what is the next headache for us? Where? Location, frontal, parietal, occipital, vertex, where? In Natrum Carb, typically the headaches will be in the occiput, nape of the neck or occiput. Clear? Tomorrow somebody might come to your clinic with headache. For all cases of headache, we can't think of Natrum Carb. So Natrum Carb typically has headache either in the nape of the neck or in the occiput. Very important. Okay. This is the location. Next thing is sensation. Each remedy will have its own sensation. Now, which symptom is sensation? What type of symptom is sensation? No. What is the type of symptom to which sensation belongs to? Very good. Who was that? Subjective symptom. Right? Because I'll just try to tell you here. In Natrum Carb, they feel head is large. This is the normal size of the head. It's a very vague example, but assuming this is the normal size of the head, in Natrum Carb, what is the feeling they are having? They feel head is very large. Is really head large? So what is this? They feel. You understand? It's a feeling. Yeah, your head is the same, go. Where it is large. It will not become large. Patient is feeling. Now that's why it is subjective symptom. One more important symptom patient is feeling here is sensation. See, please catch the word sensation as if head would burst. Do you think really head will burst? No. Heard of any time head getting burst? No. But what is the patient telling? Sir, I feel it's like a balloon and any time it can blast. Okay. So this is what we say as sensation, which is a subjective symptom. So location, sensation, and next is modalities. What aggravates? Yeah. See, I'll give you a simple clue. Any causative factor can be an aggravating factor. Okay. So whatever causation we have spoken here, you can use the same under the heading aggravation. Under the heading aggravation, use the same causative factors. Okay. So location, sensation, modality, and this is the concomitant. Okay. Now what is that concomitant? You have in Natrum Carb, headache is alternating with gastric complaints. It is not exactly concomitant symptom, it is an alternating symptom. What do you understand by this statement? When they have headache, they will not have gastric. When they have gastric, they will not have headache. Alternating. Fine? Headache alternates with gastric complaints. All clear? So head complaints are clear. Any other head symptoms that you can expect in Natrum Carb? I told you about headache. Any other head complaints that you can think of? Okay, could be vertigo, good. Yeah, sunstroke we spoke. Migraine, sunstroke, yeah, they'll all come. Good. One more very important thing. Have a look at your head anatomy. If not yours, if you can't look at your own head, at least look at my head. What could be the other problems? Huh? Don't look at my head and tell my symptoms. Sir, graying of hair, premature balding. I don't want those symptoms. But I am just giving you a clue. Keeping the ailments of Natrum Carb, keeping the mind of Natrum Carb. What else can happen under head? Simple. Hair fall. Hair fall. Hair fall. Hair fall. There's a lot of grief. There's so much of mental exertion. Fine. Not only headache, you can also have hair fall in Natrum Carb. One very important remedy for hair fall. Okay. So moving ahead. Yeah. This is I purposely skipped I and I purposely skipped yes. Nothing for a third year student. So we'll talk of what is important for you. Nasal symptoms. As a ENT student, as a third year student, you will be studying a lot of conditions related to ENT. Okay. So nose, basically if you look at this image, is got discharge. Okay. Nasal discharge. And any other remedies, quick remedies for nasal discharge? Very good. Good. Allium cipa, Natrum falls, euphrasia, Bryonia, very good. Bryonia. Arum triphyllum, very good. Good. You want differentiation of all this? Because this is where you all feel confused now. Somebody is coming to your clinic with cold. Fine. So what is the question that comes up? Sir, is it allium cipa? Is it euphrasia? Is it bryonia? Luckily we know only few remedies. As our knowledge improves, lot of other remedies will come in and it will add to our confusion. Okay. But try understanding it properly so that there will be no scope for confusion. There will be no scope for confusion. So what you need to understand here is allium cipa, quickly, ಏನು important allium cipa ಅಲ್ಲಿ? So allium cipa will have bad sneezing. Allium cipa will have bad running nose. And with that there is lot of irritation. It is so acrid. Can somebody tell me how acrid it is? Very good. It excoriates. Okay, fine. It eats of the mush. In allium cipa, fine. Don't tell me what will happen to women. Okay. In women, this area might get excoriated. In men, it is so acrid, the discharge, it can eat off the mush. Here, it can eat off. So acrid it will be in allium cipa. Okay. How is it in euphrasia? Yeah, very good. So there is no harm to your mush. There is no harm to your upper lip. It's all intact. But there will be continuous running nose. But it will not irritate the patient. Okay, it is bland. Issues he will be having in euphrasia will be with his eye. Will not confuse you now. So allium cipa, and of course we also spoke of what? Euphrasia. Now Chinmay was talking of arum triphyllum. A-R-U-M. Not aurum. Arum triphyllum. Arum triphyllum, again like allium cipa, will have acrid discharges. And probably this is the question many of your examiners ask. Why allium cipa, why arum triphyllum bores his finger? Fine? Okay, more than stuffiness, the irritation, the acridity. Fine? So they bore their finger into the nose till it bleeds. You also have it in which remedy? Which is other remedy? Sina. Sina child also bores his finger. Sina child also keeps rubbing his nose. What is the difference? It is the worm irritation. He feels some kind of irritation in Sina and so he keeps boring. So he keeps rubbing. In arum triphyllum you have a discharge which is acrid and because of that acridity they feel like boring. Okay, fine. Now Chinmay was talking of sulfur. Now that you are talking of sulfur, how is it in sulfur? Sulfur again will have discharges. It could be acrid. Now one thing you need to remember, in sulfur it is dirty. Dirty. And you will be, probably this symptom that I tell, you might start nauseating, but we can't help it. We are homeopaths. What will sulfur do? What will sulfur do? He might eat. Fine? Okay, I know. It's not a very nice thing to share, but tomorrow if you have a patient in front of you who is eating his own discharges, like for example, it's coming from the, I'm talking of young boys, young girls, it's coming from the nostril, and he might put his tongue, and he might cover everything inside. Okay, and see what happens. We have constitutions, we have individuals coming in the same way in front of our clinic. Okay, or you might have sulfur. Generally, like there is a handkerchief and all. Sulfur might take his own collar or shirt, and his shirt only might blow. So you don't feel nauseated there. You are a homeopath. What you need to understand, boss, I have a sulfur in front of me. Okay, give me a dose of sulfur. Don't think beyond. Otherwise your life will be miserable. If you are very sensitive, then you can't eat, you can't drink, you think of him, how can they do this? Don't go beyond. You put a line. So sulfur very dirty. Fine? And even the discharges in sulfur are dirty, offensive. At least if it is not offensive, it's a different thing. You put your tongue in. But very offensive discharges, sulfur. Somebody was talking of bryonia. Okay? Yeah, bryonia will have more of stuffiness. Bryonia will have more of dryness. Okay? Now here in Natrum Carb, the discharges, just have a look here, they are thick, yellow, green, offensive. Okay? So you don't give Natrum Carb when it is thin, watery. And this is what I want you to understand. Fine? When the discharges are more thick, yellow, green, offensive, this is where one thinks of Natrum Carb. The remedy quickly that you need to remember here, this kind of discharge. Very good, pulsatilla. Yeah, natrum sulf. Natrum sulf will have more greenish. Okay, good. Somebody was talking of pulse. Pulse, morning it can be yellow, afternoon it can be green, and evening it can be white. And tomorrow again a different thing. Changeable. Good, beautiful. Now one more remedy I want you to think of here. I don't know if it is over or not. Is hepar over? Hepar sulf? Yeah, hepar is what that should come to your mind. How is it in hepar? Huh? How is it in hepar? Very good, thick yellow, agreed, beyond. What is the character of offensiveness you have in hepar? Huh? More than SAR, good. SAR is also there. It's not cadaverous. Which is the remedy which has cadaverous smelling? Very good, arsenic. In hepar langirata discharge. Hepar, it is like rotten cheese. Cheese. Rotten cheese. Spoiled cheese. Dirty smelling, sour smelling, greenish, yellowish, like rotten cheese. That is hepar. You are getting my point. Each remedy will have its own characteristic discharge. And that is our basic principle, individualization. Everybody you can't give arsenic. Everybody we can't give alum sipar. Based on the presentation, based on how they are presenting, you please decide the remedy. Then, you go ahead. So, here the discharges are foul, offensive, thick, yellow, green. There is violent sneezing and there is post-nasal dripping. From the nose it will enter the mucus, oral mucosa, and the sputum is coming out. Post-nasal discharges, very important. So I have used the word, okay, fine, post-nasal discharges. So this is with the nose. We spoke of head, we are speaking of nose, and very important for you will be, very important for you will be the jail. Okay, anyway, I'll explain this. animation is done, not done, but J, please act as if you are not seeing this, or please be, I can't stand here like this, but try to focus on this, fine, and use your common sense, use your intelligence. As a third year student, as a surgery student, as a student who has finished pathology, physiology and NAT, what could be the probable symptoms you can expect in Natrum Carb? Okay. Now first thing, sphere of action. You go back to the last class, I told you about its action on the J. Very good, good, that is the word, first word. It causes weak digestion. Digestion in Natrum Carb is weak, good, okay. Now the next question is, when the digestion becomes weak, I am trying to block as much as possible. When the digestion is weak, what are the symptoms you expect in Natrum Carb? Huh? Grief. No. When the digestion is weak, what will happen to the J? See, diarrhea is the other end. Don't go there. In the stomach, yeah, there can be indigestion. Okay, there can be indigestion, there can be acidity, there can be heartburn, fine. Okay, there can be pain in the sternum, gastritis, bloating, acidity, and if you see a little higher, you can also find ulcers, gastric ulcers. So let me finish this because it's already exposed. So what you see here is, there is weak digestion. So here you see sour erectations, okay, huli tegu, indigestion, acidity, heartburn, gastric ulcers, and very characteristic in Natrum Carb is they feel hungry at 5 a.m. Very characteristic. 5 a.m. they feel hungry. Beligge 5 a.m. they feel hungry. They want to eat something. So this is what happens because of the weak digestion. Okay, done? Done? Okay. Now the question for you is, what causes gastric affections in Natrum Carb? Huh? Okay, slightest error in diet. Any small change in diet can bring in gastric complaints. Very good. First point. Milk. Second point. What will grief cause in? Yeah, good. So it could be grief. Very good. Who was that? Drinking cold water in hot weather, and of course grief or sadness can cause pain in stomach or pain in abdomen. So ailments from. See, this is how you will be writing in your exams also. Once you understand the concept, you need not trouble your friend, fine, who is sitting next to you. What is the answer for this question? And your invigilator scolding you, all that mess we can avoid. Understand the concept. When nitric acid, when Natrum Carb, stomach complaints are asked, the picture should just come in front of you and you should be in a position to write. That's how you should be trained. Okay. So we'll get back here. We're looking at the ailments from, you have given all the right answers: milk, errors in diet, drinking cold water in hot summer, and one of your friend also added grief. Okay, grief. Yeah, you saw heartburn, you saw acidity, lot of things coming up. Even today in allopathy they use Natrum Carb to decrease the acid secretions. Okay, so this is one thing. Now another very important thing you have here is abdomen, and one thing you already know, what happens in abdomen. One of your friends used bloating. Abdomen gets bloated. Okay, bloating of abdomen. And what is causing bloating of abdomen? Milk. Good, milk. Sir, I can't take milk. What should be your next question? What happens when you take milk? Sir, if I take milk, my abdomen gets bloated. Natrum Carb could be a remedy. Fine. So bloating of abdomen, and very important we saw here was diarrhea. What was the cause for diarrhea? Milk again. Fine. And there are a lot of remedies in which you have milk as a causative factor for diarrhea. Which are all the other remedies? Very good, Echusa. We also spoke of sepia in the last class. What was the reason I gave you in sepia? Boiled milk. Okay, ailments after boiled milk, especially diarrhea. So ethusas, you can also add sepia, you can also add natrum carb. Diarrhea from starch, meaning a food which is rich in starch. Okay, any food which is rich in starch can give rise to diarrhea. The diarrhea from starch, one, and diarrhea from milk. See, now very important thing for you will be the character. What is the character I am trying to focus here? Character of stool. When Nitusa, when sepia, when any other remedy, or when natrum carb. In natrum carb, cause will be milk and the character of stools will be like orange pulp. Okay, stool will be like orange pulp. You know that orange pulp? You would have seen. So that kind of an appearance is what you have. In the diarrhea, the stool of natrum carb. Sudden urging. Stools escape with haste and noise. Meaning he gets a bad urging and he can't control. What is it? Stool is a voluntary or involuntary thing? Voluntary. It's under our control. Fine. Even in natrum carb it is under his control. But there is lot of urgency. Fine. He has to literally rest and is afraid 1 or 2 more minutes if I delay, it might just escape. Okay. In which remedy stools escape with flatus? Natrum sulf. Very good. Natrum sulf. One more remedy. When you are told natrum sulf, aloes, want of confidence over sphincter ani. He has to always, his focus will be always there. And 1 second if he releases, he feels stools will escape. And many times he can't even pass gas because he's got fear, or that is the situation in aloes. With gas, with flatus, the stools also will escape. So they are very, very, very conscious. Want of confidence. See, where is he not having confidence? He is not having confidence in himself. That is not the situation. He is not having confidence over the sphincter ani. Fine? Okay? Done? So that is aloes. And you also have natrum sulf. But in natrum sulf, what is very important is stools will be very noisy. But very noisy stools. Right? Those noises might be missing in aloes. But in natrum sulf, it will be very noisy stool. Okay? You have this bullet Enfield. When they start, from the silencer you have sound coming, no? So from that silencer you will have sound coming here. Right? So orange, pulpish, sudden urging, stools escape with haste and noise. Okay? Now very, very important. Probably the last part of natrum carb. Now before I talk of this part, the natrum carb part, a quick revision of what we spoke. Okay, we spoke the particular symptoms and I just gave you how you study a particular symptom. 4 components become very important. First, sphere of action and pathogenesis. Second, ailments from. Third, PQRS. 4, modalities. If you remember this, please keep applying. And of course your knowledge of allied subject, surgery, pathology, organon, fine. If you remember all those things, you can just keep, because see, when I talk of eye, as an ophthalm student, you know what pathology can happen in eye and you can put it there. It's easy. We'll explore more after some time. So headache is what I spoke. I spoke to you about the nose. What was the discharge in natrum carb? Thick, offensive, yellow, green. Fine, yellowish green. Thick offensive from the nose. Okay. And what caused diarrhea in natrum carb? Milk and starchy food. Starchy food. What is the character of stool? Orange pulp. Fine. I hope this is clear. Now we'll talk of the female. One very important thing for which Natrum Carb gets indicated is a beautiful remedy for infertility. Okay. Can somebody quickly recall the case I spoke in the first class? Young couple, good, beautiful, all reports normal. Husband's semen analysis, husband's hormone test, ladies scan, ladies follicular scan, ladies hormone test, all fine. But they were not conceiving. Fine. Okay. I did not treat the husband. Okay. Now this lady, if you look at the mind, very nice lady. Very nice lady. Fine. Many times, if you come to final year, they will be teaching a remedy called as carcinosin. Somebody will talk. Very gentle, very mild, very nice lady. Lucky husband. He's got such a, I don't use the word beautiful. She was, let's not look at that part, but very down to earth lady, very mild, very gentle, typical wife. Fine. Okay. And she was also very good in art, drawing and all. Done. And she was very keen to conceive. Almost 3-4 years, they've seen a lot of doctors and nothing is helping. Fine. But she is keen to be a mother, very, very important. But nothing is happening. Now, a beautiful thing that I will be sharing here, please remember this, when everything is normal, as a third year student, what could be the problem? Some good friend of yours spoke, probably no intercourse, beautiful, yeah, could be the girl is afraid of intercourse, fine, fear, and she says no, or she might have had some bad sexual abuse in childhood and she says please don't come, I will remain your wife but don't touch me, I got some bad memories, please, fine. That's why all reports are normal, good, beautiful. And then Chinmay spoke of a point, way ahead of your class, way ahead, and that's a beautiful point. Never forget this point what Chinmay has told when you are treating an infertility case. Fine. If the issues are with mother, if she is not producing egg, that is the first question that should come to your mind. And what is that question? Why you don't want to become a mother? Beautiful. Okay. You will understand this a little later, but a valid point. And of course your friend. See here, she wanted to become a mother and they were also having frequent intercourse. All fine. So both of your answers are not fitting into this case. Fine. Then what is the problem? Any wild guess? Okay, weak uterus. Okay, one more friend of yours says weak uterus. Okay, fine. Anything else that can go weak in Natrum Carb? Yeah, weak uterus, good. Before that, don't go that high up. Before that. Yeah, who's that? Chalo, bolo, very good, correct. Good. There's some issues with the connective tissue. Good. I am sorry I don't know your name, but anyway, with the mask and other things, very difficult. Anyway, one of your friend is telling connective tissue. Can you connect what you want to tell? Okay, tell, go ahead. I to connective tissue. What is Natrum Carb doing acting on the connective tissue? Weakness. Good. Now what is happening in Natrum Carb is, when there is an intercourse, you all know from the physiology, the semen, fine? The male ejaculates, and from the semen the sperms move ahead and all. In Natrum Carb, what is happening? The vaginal muscles are very weak, fine, and the semen is just coming out instead of going in. And this was what was happening in this couple. All reports normal. Please remember, your job is very easy. You have only few remedies that will come up. And one top remedy is Natrum Carb. And the indication of Natrum Carb is outflow of semen. Are you getting my point? See, if you don't understand, you will miss Natrum Carb tomorrow. Very easy. What is the easiest part? All reports normal. Fine? No issues, no tubal blocks. I want to become a mother, I want to become a father, everything emotionally, physically, all fit. Sperm count, all fine. But what is the issue? When they are having an intercourse, instead of the semen going in, you know the process of zygote formation, egg from the ovum will come, fine, and then you have this, what is it, the sperm, the strongest sperm will go hit the, all that you know from your physiology. But that process is not happening in this case. Egg is getting released, they are having intercourse, but unfortunately there is outflow of semen. Okay, done. And this is when this lady was prescribed Natrum Carb. See the magic. Hardly 2 months. Hardly 2 months. And I told you, no, 33rd or 34th day she did not get her menses and she was literally jumping. And her husband was telling, please, what if something happens? You don't jump so much. And you know, they immediately rushed to the clinic, and I told you, if you want to identify pregnancy at a very early stage, I told you, you can't identify with the preg color, fine, through urine. So what do? We get the serum beta HCG done, fine, and generally it will be very high. Okay, and luckily in her case it was very high, they were very happy, and she conceived and she delivered. See, our part, once there are few patients who come back to us, and there are few patients, you know, they generally jump to the gynecologist once the job is done. Okay, they want to be under a gynecologist, fine. Anyway, she moved and she conceived. Now this is what happens in Natrum Carb. Please keep all these things in mind. Infertility is a pain. People are spending lakhs. IVF, IUI, you name anything, there are so many clinics that have come up, and you know, they're spending lakhs, they're selling their properties for this, fine. And if you can practice homeopathy correctly, if you can understand what is the mind, what is the physical thing, and try to understand, you can do wonders. Okay, and this is a wonderful remedy. In this, see again, all cases of infertility, Natrum Carb will not work. Don't put a board, infertility clinic, and every lady who comes, Natrum Carb. Please don't do that. Similia similibus curantur, and individualization. And this case I could help because there was outflow of semen. That's why Natrum Carb worked. Otherwise Natrum Carb will not work. And luckily her mind also matched Natrum Carb. Very mild, very gentle, very conscientious female, very artistic. I got a lot of things. And one more clue I will give you. What was the clue I told you was sun aggravation but chilly. Again underline this. I have used it last 25 years. Whenever they have sun aggravation and sir, I cover, I can't tolerate, I feel comfortable. Not comfortable, meaning I am chilly, but sun aggravation. The remedy is Natrum Carb. It's a beautiful practical hint I am giving you. Infertility from non-retention of semen. Infertility from non-retention of semen. And why this non-retention of semen is happening is because of the weakness of the sphincter, vaginal sphincter, and it comes from its action on the connective tissue. Okay. Now see how important the sphere of action is. Very simple case, a dose of Natrum Carb, she conceived. But to arrive at Natrum Carb, that is the difficulty. I am giving you the result. You are all very happy. Sir, one dose Natrum Carb we gave and she conceived. But why did I give? What was the thought process in my mind? That becomes very important. Okay. So promotes conception. See, beautiful. Meaning, naturally it is promoting conception, no? Infertility, it is promoting conception. Motion as of fetus in uterus is an independent symptom. But what is this? Motion. See can somebody quickly decipher what is this sentence? Don't look at my face, please look here. I asked you to look at my head when I was doing Natrum Carb headache. Every particular symptom, please don't keep looking. Right? So what is very important here is motion as of fetus in uterus. Very good. Somebody, yeah, good. Sensation of. Somebody is using the word pseudocysis, so pseudo pregnancy. Many times it happens with women. 6 years, 7 years you are not conceived. So, you know, you will have all those feelings. Fine. Very sad part, but this is what is happening in Natrum Carb. Motion as a fetus in uterus. Any better remedies that you can think of? Huh? Beautiful. One top remedy is sulfur. You have one more chance. One more remedy you can think of. Sensation as if fetus is moving in the abdomen. Who's that? Who was that? Beautiful. Joseph. Correct. Tuja. Good. Tuja. Tuja and sulfur are two top remedies. You can also add Natrum Carb. You can also add Natrum Carb. What is the symptom? As if fetus is moving. As if the fetus is moving. Okay. So, see, this is also a beautiful thing. False conception. What is it? False conception. As a third year gynec student, obstetrical student, what do you understand by false conception? False conception. Huh? No, psychological is over. We spoke of pseudo-cysis. See, what happens in false conception is, see, a uterine growth consisting of a mass or a degenerative mass instead of fetus. You will be reading moles, M-O-L-S, moles. Fine? And this mole is there instead of the fetus. Fine? Okay? And it gives you a feeling of false conception. See, now how is it different from this? Somebody quickly? Beautiful, good. I want that quickness. I know everybody of you know this, but the person who pursues it quickly gets that good. So here, see, there is a mass, meaning there is something. And here, there is nothing, but we imagine that there is something. Here, there is something, but it is not fetus. You are getting this? So false conception. Okay? And it expels those false conceptions, whatever the mass, the mole, whatever is there, it expels. Better remedy? Sabina, to expel moles. One more remedy you can also put it in bracket is Cantharis. We discussed, or it's there in YouTube, you can just have a look. Cantharis, okay? So expels moles. See, now this slide is very important. It becomes important because it promotes conception, and when there is this outflow of semen and male female both are normal, you can think of Natrum Carb. Okay. Now what else you have in Natrum Carb? Yeah, now tell me, under the genitalia, the female genitalia, why prolapse? Why weakness? Why connective tissue? Because the uterus is supported with connective tissue, correct? Ligaments. See, this is how you have to study materia medica. Yeah. Then materia is fun. Then you fall in love with materia medica. Otherwise, prolapse. But why prolapse? See, when you start questioning why, it will also give you confidence. Yes, there is some scientificity behind this. It is not just happening, just like that. You are clear? Fine? See, and the more you trust, the more you believe in the subject, the more you believe in the system, the more strong you will be to convince your patient. If you yourself, you don't believe what that sweet pills, they give sweet pills, what will homeopathy do? If you get that concept, then you can't become a good homeopath. Because you yourself don't believe. Fine? Okay? But the same sweet pills I have given, I have seen results, and I believe. Fine? Because my belief in my system is more strong, and I can convince my patients. Sir, this is how it is, this is what we do, this is how homeopathy is, you can convince. First, it is very important, as a student, you get convinced, but that there is some stuff in our system. Unless you don't get convinced, you cannot become a good homeopath. And trust me, this is the beautiful system. I am not telling it because I am on the stage and I am a homeopath. I am not telling it out of force. I am telling you from my experience. Way back, 25 years back, when I was sitting like you, I was thinking, some teacher will come, tell something, and they go. Fine? Ragged philosopher. Sulfur. Okay, then many of my friends would make fun. Any madman going on the street with cap on his hand and he'll be in his own world, then my friends would tell, no, can we give sulfur? If we give sulfur, he'll become normal. Yeah, we also would make fun. But then as we understood the principles, as we understood organa, philosophy, materia medica, then now nobody can stop. Then, so that belief you should get. Naturally, you get belief with experience. Fine, I don't deny it. But at least be open. Don't shut your what this thing. Yeah, it's only sweet pills. It's placebo. Don't have that feeling. It's a great science. And see, any science, we are here from so many centuries. If it is fake, nothing will sustain so long. And every day the popularity of homeopathy is increasing. Fine. Many percentage of people, is going high. It's never declining. So there is a great scope, but you need to focus. If you don't study, if you don't focus, then homeopathy will not give you anything. What Dr. Stuart Close has told? What? No, that's one more thing. There's one chapter now. What young person gives? There's a chapter. What is it? Can you be a little loud?
What homeopathy has to offer to the
Young person, okay. There's a beautiful chapter. I learnt it very long back, and I thought somebody will support me, and unfortunately, all of us said, let this man suffer. It will not help you. So there's a chapter. If I remember the first chapter, what homeopathy has got to offer to the young generation. Beautiful chapter. Okay. So we will not divert much. We'll come back. And as rightly told, it is uterine prolapse because of the weakness of the connective tissue. Fine. Any other remedies for uterine prolapse? Very good. Sepia. Murex. Beautiful. Good. Murex. There are a lot of remedies. Lilium tig, belladonna, agaricus, lot of remedies. Fine. Now, how is it in Natrum Carb? Bearing down as if everything would come out. See, so beautifully they have used the word as if. Nothing is coming out. But because of the weakness of the ligaments, what is that feeling? That support is lost. So what is that feeling? Everything is coming out. Okay? And this feeling is more when they are sitting. The moment the lady gets that feeling when she is sitting, and once she starts moving, she feels comfortable. That is Natrum Carb. And prolapse or this feeling, bearing down sensation before stools. This bearing down sensation in Natrum Carb, they get it before stool. Then, if it is during stool, I don't know if that remedy is over for you. If it is during stool, the remedy is podophyllum. Somebody will teach you podophyllum. So before stool, bearing down sensation is Natrum Carb. During stool, bearing down sensation is lilium tig and podophyllum. Two remedies. Okay. We'll go ahead. We will look at another part. Now, what is that other part you also have in Natrum Carb is leukorrhea. Any wild guess what is the character of leukorrhea? You saw the nose. You saw the discharges. Fine. Similarly, in this particular area, you see leukorrhea which is yellow, leukorrhea which is offensive. So any discharge in Natrum Carb is yellowish, is offensive. Yellow, offensive, irritating and ropey. R-O-P-I. What is the meaning of ropey? Good. The other word is stringy. It is coming like thread. Rope means not your big rope. It is coming like thread. Daratara. Ropey discharges. So ropey discharges, you have Natrum Carb. Clear? Okay. Now one last thing. What do you expect under extremities? Use your common sense. Huh? Weakness. Very good. See. Yeah, good. 3 points. Weakness, sprains, dislocation. And your friend says ankle joint. Beautiful. 4. But unfortunately, tomorrow all 4 you will not sit together and start a clinic. Correct Allah? You will be independent. So each of you should start thinking like this. Extremities. So mainly the ankle joint in Natrum Carb, it gives away. meaning it gets dislocated. For dislocation to happen, the connective tissue should be weak. They are not very strong. Relaxed, weak connective tissue, ankle joints dislocate. Don't forget, very important. Okay. So this is what happens here in Natrum Carb. And last sphere of action is skin. So skin basically you have dryness, as if it is parched, dry. You have known or you have seen parchment paper. Voilà? You know, that's the kind of look you have. It's all parched, dry. Done? So dryness of skin, chopped, rough skin, blisters on small joints, tips of toes and fingers. So tip of the toe, tip of the fingers, you have eruptions, blisters. Okay. So that is what you have in Natrum Carb. Done. Now the last part is the modalities. What aggravates, what ameliorates. See, they feel better by eating, especially the gastric complaints. They are better by eating. Eating, rubbing, you know, motion. Which complaint is better by motion? Bearing down sensation, prolapse. Okay. Pressure. Wiping with hand, boring into the nose or ears with fingers, sweating. These things they feel better. And aggravations, you have so many. And what was the clue I gave you? Many ailments. See, for example, sun, music, mental or bodily exertion, milk, diet error, thunderstorm, okay, starchy food, cold drinks when heated. Almost all these things can come under aggravations. You also have something very important, onanism. Any idea what onanism is? Masturbation. Masturbation. So masturbation can aggravate. Okay. What aggravates at 5 a.m. in Natrum Carb? Good. Hunger. What issue? Hunger. Good. Now the last thing, I have taken this from Clark's Materia Medica. What is the last part of? The clinical utility of Natrum Carb. Where in clinic? For which condition one can think of Natrum Carb? So I got a big list, big list, starting from kidneys, albuminuria, and ending with warts. You have a big list. Okay? You have moles, you have rheumatism, stammering, prolapse, sunstroke, headaches, whatever I have told you can combine. See, Dr. Clark has given, according to the knowledge, the medicine which was developed during this time. Now you can apply Natrum Carb for better disease conditions. Okay, fine. Any quick questions? So to sum up, Natrum Carb is a beautiful remedy, mainly a constitutional remedy. Fine. But for a third year student, the mind, the gastric complaints, the respiratory complaints, the female complaints might become very important. If you are lucky, they can ask you a question, describe the drug picture of Natrum Carb. But clinic, it's very important. One word again I repeat before I close this class, sun aggravation but chilly, that has to be highlighted. Any case you have this situation, and if you introspect the case, it's more towards Natrum, please don't miss Natrum Carb. Okay, Natrum Carb, beautiful remedy. Done? Any questions? Anything you want me to repeat? Any clarification? In the Uduguru? Clear? Right? All clear? Chalo. If all clear, we'll stop. And next Tuesday, we'll start with a new remedy. Slowly, I will try to take up polycrest. We are done with small remedies. We will now focus on bigger remedies. Okay, thank you.
Sir, in that case, what was her age, sir?
She should be some 28 or 30. Okay. 28, 30 years old lady. The case your friend is talking about. Okay. Anything else? Chalo, thank you. Thanks.